The increasing availability of digital technology, especially in the form of the internet and mobile phones, is expected to dramatically change the way mental health is monitored and treated. Based on the literature review of current digital implementations of mental health, as well as research and studies of existing mental health-related applications regarding their limitation and challenges, our group found that majority of the health-related applications requested dangerous permissions to access users' device data. Nearly half of the application failed to declare how such personal information is collected, retained, and shared with third parties. Lack of evidence-based treatment practice among health-related applications. To address the above-mentioned challenges and limitations, this project proposed a medical application that can be accessed via smartphones and wearable devices by the patients. There are 4 key features that will be incorporated into the app. A major focus of the app is to connect the patients with an available professional mental health support services, either through live chat or video calling. This will provide an opportunity for the patient to voice out their feelings and concerns so that the appropriate assistance can be offered to minimize any incidents. Patients can also allow the app to store the conversations into their EHR so that it can be used in further treatment. Research has shown that mindfulness-based training can effectively improve people's well-being. The medical app will introduce multiple short meditation exercises to encourage mindfulness practices. These exercises can be in the form of activities, readings, and even mini-games that patients can complete on their way to work. In addition, patients will be rewarded for their meditation efforts, which can create a sense of achievement. Using wearable devices, patients' vital signs and sleeping data can be monitored by the app for any abnormalities, so that attention can be provided in advance for better patients' health outcomes. Patients can set their sleep goals and notifications will be sent when it's bedtime. The sleeping data can be viewed as a summary for patients to track their progress, and if the sleeping data demonstrates some long-term abnormalities, actions will be suggested to the patient, such as referring to a specialist, so that they can address those issues to improve their sleeping quality. The mood check-in feature will let the patients to document their feelings and thoughts, which let them understand why they feel that way and what actions can be taken. If the app detects that the patient is in a negative mood for a long period of time, recommendations will be provided, such as suggesting a chat to a specialist. The medical app will follow the health informatics standards to ensure patients' health outcomes are not compromised. As the app involves significant amount of private conversation between the patients and the therapist, an experienced team will be recruited to take charge of this standard in terms of data security. To improve the accuracy of the patient's information in EHR, a standardized communication approach will be adapted to the system. For example, predetermined text such as text boxes will replace most of the free text boxes to build a better standardized language. During the sign-up process, patients can choose whether they allow their data to be recorded in the EHR. They can also change the settings anytime within the app to maintain their data privacy and rights on choosing who can view the data. To assess the usability and acceptability of the app, we proposed methods of classifying behavioral change techniques and field testing. For example, collecting feedback from the clinician following interaction with the patient. A proposed experiment to evaluate the health impacts of the app will involve an observational study which involves a set of participants who use the app. This would include observational testing before and after the study to determine whether the app has an impact on the participants. It is important to know the ethical challenges when developing the app. Australian privacy laws must be respected in the development. It must have an open and transparent management for all the personal data imported by both clinician and app user. Options for anonymity and pseudonymity must also be considered, as well as the collection of personal information. In future iterations, this project could focus on the potential and opportunities for different approaches to collecting and using patients' health data, such as incorporating sensors and other advanced technologies, and how this could change the way informatics is used in the field of healthcare.